My name's Morgan McCormick. I'm a psychiatrist. My role here is essentially providing psychiatric consultations and working with other IHA providers. We know that people that have poor mental health tend to have worse medical outcomes, so ultimately my role here is to provide a better psychiatric care so we can get to better hematologic outcomes. I've always really enjoyed hearing people's stories and kind of trying to understand why people do the things that they do, so I was interested in psychology pretty early. I actually first got to know IHI as a patient. So I have a chronic blood disorder, and I got connected here through the diagnosis and that treatment process. I really want my patient encounters to be a safe space. I would want patients to understand that the decision of what medication to start versus whether we're starting medications at all can vary greatly from person to person, just based on what they want outcomes to be and what their personal choices are. An appointment with me is set up like any other provider's appointment through IHI. The appointments are conducted by telehealth. A lot of times with psychiatry, I think there can be a lot of anxiety about what that appointment's going to look like, and ultimately it's just like any other medical appointment, except we're probably talking a lot more about day-to-day life. I think just across the board with psychiatry, I think people come into an appointment or any interaction with certain preconceptions, and trying to provide education about what they can expect and where these disorders and issues come from, I think can do a lot to alleviate that anxiety.